Good morning, good afternoon, depending on which time zone you're in. My name is Joe Feldsien. I'm the Senior Vice President of Clinical Technology Enablement at Pacific Dental Services. The webinar that you're in is called COVID-19, the impact to dentistry and the new normal. Today's conversation is going to be between two leaders in the dental space, Steve Thorne, founder and CEO of Pacific Dental Services, and Don Casey, CEO of Dentsply Sirona. So welcome, gentlemen. We're glad to have you guys.
Hey, thanks for having us.
Yeah,
Absolutely.
thanks, Joe.
Yeah. Today, we will talk about the impact the pandemic has had on the dental industry. We're also going to talk about how these two have found a way to navigate not only their businesses, but also have had influence on the dental space broadly. And then whether there are long-term expectations, what's in store for dentistry mid to long term? What's it look like for those of you on the call? For the purpose of the call, we'll have about 30 minutes where these two gentlemen are going back and forth with their perspectives on things. And at the last 10 minutes, we'll have Q&A. So I invite you immediately, if you have questions, to begin submitting them via the chat function. So with that, we'll get started. I'm going to ask Don to kick it off. Don, talk a little bit about what you've seen in terms of the pandemic's impact on the dental industry, and then even specifically to Dentsply Sirona.
Sure, thanks, Joe. And by the way, thank you, Steve, for the invitation. It's always great to catch up with you. And I'm sure this is going to be a lively webcast because I had a conversation with Steve where fireworks haven't flown. So, you know, look, I think the COVID-19 pandemic has impacted dentistry in a number of ways. I mean, I'll start very broadly and then get specific. I mean, we're a global company. We do business in 160 countries. And what you see in the U.S. is pretty much what you see almost everywhere else. You know, we have the advantage. We saw Asia kind of go down. It's starting to come back up. And parts of Asia are now normal. You know, Hong Kong, Taiwan, Korea, normal. So that gives me a great deal of optimism about where we're going to get. You know, in Germany, interestingly, they never shut their dental office down. They never declared dentistry anything other than essential to overall health. And you know what? People have chugged along. I mean, we're seeing Germany off a little bit, but it would look like kind of a bad flu season versus something else. In the U.S., you know, I think what we've seen all around the U.S. over the last month. I mean, we had an earnings call and we said, we're down 60 to 80%. And, you know, in my mind, that's been a mistake in a couple different ways. I think that early on, because there was not a lot of knowledge of how the virus was going to interact, concerns about aerosol and other things, that there was a declaration that we should shut dental offices. Part one. Part two is that they're not essential. And just my way of thinking is dentistry is totally essential. It's one of the building blocks of oral health. I think that, you know, we've kind of done a little bit of a disservice to dentists in general. I mean, dentists have been managing infectious disease, bloodborne pathogens for decades. And I really, you know, I was happy to see Susan Collins yesterday, the senator, really kind of get after the CDC about let's get some dental offices opening, because I think we're going to see a long-term deleterious impact on overall health because we've shut the dental offices down. So I know I've started and there's some good optimism. We'll see Asia come back, but you know, in the U.S., you know, to be honest, we're starting to see some things open up. I just think we've got to do some repair work with the patients, and the idea that dentist offices are safe. We've got to rethink a few things, you know. Right, Steve, right. You know, I always ask you, how are you doing? Because I kind of think of you guys as some of the most advanced people that we talk to. You know, like, what are you seeing across, you know, your very, very broad network?
Well, you just got on my soapbox, so we're now standing on the same soapbox, Don. Yeah, this crisis has demonstrated the identity crisis of dentistry in the United States. Dentistry should have never, in my opinion, never been deemed non-essential, never been brushed aside and asked to close and not be part of the solution. Dentists were asked to only do emergency care, and most dental offices in the United States, unless they were part of a large group, couldn't support that financially. So most dental offices chose to close. some of the studies towards the end of April were showing that up to 97% of dental offices were closed in the United States. Some of the data I've seen show that the revenue for dental offices in the month of April, it was down 96%. So it screams of where was dentistry? Where were the leaders of dentistry? And I guess Don and I are some of them, but where was the identity of dentistry? Where was the leadership there to say, hey, look, we can be part of this solution. We need to help. There was a great study released by the British, I think it's a British Dental Association or Society or something like that, that showed, right?
Yep.
That showed that dentists could, by doing cleanings and some of their SRPs and helping reduce inflammation, would have helped in this pandemic, help patients reduce the inflammatory response. So yeah, I think this is a wake-up call, absolute wake-up call to dentists in the United States. Now that I'm not worldwide, so, and I've been on a lot of those same calls, Don, listening to what's going on in Europe and Asia and that. But my primary focus is in the United States, and this is a wake-up call.
Yeah, and Steve, I think you're highlighting something that's near and dear to, I know, both of our hearts, and that is, how do we put a face on dentistry right now coming out of COVID? And whether we do that as companies, whether we do that as individual dentists, I think it's imperative that, I almost want to give everybody a button that doesn't say Pacific or Dentsply Sirona. I'm essential. And, I think we've spent 2 decades thinking about really establishing that link between oral health and overall health. And
Right.
By the way, how do you manage, whether it's the inflammatory response or, when we start talking about a geriatric population, how do we make sure that they're thriving, and oral care is essential to that. And, look, I think we have an opportunity right now as we begin to come out that we have to message as individuals, as companies, and as a group, that we are essential, and that taking a step back in oral health right now is just going to pay unfortunate dividends over the next 5 years, and I think we're going to see it.
So one of the things that most of the PDS docs chose to stay open, so roughly 700 practices across the nation, many of the larger DSOs and even medium-sized DSOs did the same thing. Their docs chose to stay open and serve the public. And if I remember our numbers right, from about March 15th through April 30th, I believe we had about 65,000 emergencies come in. 65,000 emergencies that couldn't get help elsewhere. And I think if we asked any one of them if we weren't essential, I'd be shocked if we even had one that said we weren't essential at that time.
And Steve, an interesting discussion, because, and one of the things I've always been very impressed with Pacific, PDS, I think, is on the forefront of data collection. It's going to be very interesting, in my opinion, that you now have had 65,000 people walk through one of your storefronts. And, when you get in an office, have you seen, any kind of impact on your dentists? Have the dentists all of a sudden seen a dramatic rise in the number of people who've been, gotten COVID, or the patients on the other side?
So I'll give you some data that will be proving out further in the coming weeks. But it's a great point, Don. From March 1st to April 30th, people reported dentists 403,287 patient visits into the practices. 0 documented transmissions of the coronavirus in a PDS supported facility. Now, understand that we, as part of a large group, we had our crisis management team begin on March 10th. We met every day, and then starting, I think, on the 17th, meeting twice a day. So we were ahead of the game, jumped out and got plenty of PPE, all that stuff. So our clinicians were never left without adequate PPE. But let me back up to what you said earlier. I've been in this space for 32 years now. This is all I've done. Dentists are pros at being safe. They are pros. They deal with splatter and blood every day. They know how to do this. They're taught this from the earliest stages in dental school. And so most of our supported dentists didn't think twice. They've dealt with HIV, they've dealt with TB, they've dealt with hepatitis. We can go right down the disease list, and it hasn't deterred them in the past. Now, this virus, we're still trying to understand it, right? It is a coronavirus, and coronaviruses have been around. I think it's a form of SARS or something. I don't know.
SARS-2.
Yeah, SARS-2. So I'm not a scientist, but as I understand it, and that we still don't know exactly how it's transmitted. So then we get into this stuff going on right now about aerosols and blah, blah, blah. But we don't have the science to prove that yet, as I understand it. So there's a lot of leadership gaps in dentistry. There's a big hole here that we need to fill, and I know you and I have been talking about it, that needs to be filled to help dentists and dentistry be part of play a bigger part in overall health in humans across the world.
Yeah, and Steve, I couldn't agree more. And I think you're hitting on a really important point. And first, the data that you're talking about, that's got to get put out to the public. And I think we also have to help both the dentists and the public begin to understand things. I mean, there's a concern that the patient could infect the dentist. Then there's the concern that the patient could, leave something behind, that's going to, in a waiting room or an operatory. And,
right.
I completely agree with the statement you said. I mean, if you go down the last 20, 30 years, first we had HIV AIDS. Then we had, take your pick, Hep A, Hep B, Hep C. There's been TB, and I know you guys are very proud of a lot of the work you do, kind of on a pro bono basis, where you don't necessarily know what other potential symptoms somebody who might be indigent is going to present to you.
Right.
So
right.
I think the first thing a dentist does, literally the first day, we talk about patient safety. Because you've got, the first rule of any doctor is we do no harm, and then the second issue is, well, obviously, the dentist has every incentive in the world to protect herself or himself. And, again, it's not as if, dentists have been exposed to aerosol that they take off their mask and breathe deeply. It's always been about masks. It's always been about gloves. I mean, the funny thing is, if I saw my dentist on the street, I'd have no idea what she looks like, because, she's always been gowned up with a shield, loops, and you'd never recognize it. So
I agree.
I think we've got to emphasize that. And then when you bring patients into the the new normal, what is a Pacific Dental, basically from start to finish, what does that look like? How are we seeing a little bit more PPE with the receptionist? How are we seeing conspicuous cleaning? How are we going to manage? Hey, just stay in your car and you come right in. All of that's going to, and I think some of the stuff that Dentsply Sirona has to do is, how do we help you talk to the patients? Because that's consistent with everything we want to
help us get all this stuff at a really low price, because it's killing us financially.
Oh yeah, every night, Steve, I always pray for the poor people in India, and then Pacific Dental, where Dentsply Sirona is charging them too much. But
I'm with you. The protocols have changed. You and I were both in healthcare back when the AIDS crisis hit, and the protocols changed.
Yep.
And I think the protocols will change here too, and probably forever, with the pre-screening techniques. We're using teledentistry to pre-screen. We're pre-screening people outside of the threshold we call screening for temperature and various contacts and things like that. if they're in a place where they have to cross the threshold, they're isolated in a small space within the office where they're checked. And yes, the front office now has PPE, maybe not as much as a dental assistant, but that's all real. The patient will be escorted to their room and not move around and leave the room. I guess if they have to use the restroom, that's something we'll have to figure out.
We're going to have the hall monitor, Steve.
Yeah,
you have to use the restroom. I'm sorry, that's unacceptable.
You got to raise your hand. Right. So there will be, I think there will be changes, and there will be a change in volume for patients. This is very, very important for all of us to understand. It's going to impact your organization, our organization, every dentist in America, in the world, right? In the world, they will see less volume of patients. But the good thing is, they will probably be doing more of the dentistry that the patient needs per visit. So I think that actually reduces the risk of transmission. It reduces some of the issues we face with patients coming back and that sort of thing. It can reduce the doc from jumping room to room, which is more traditional for dentists in America, at least. I don't know about the rest of the world. I think in Asia it's that way, but I've heard in Europe it's a little different.
Asia looks like the U.S. Europe is you stay in one operatory.
You stay in one op, right. And so I think we're going to be more European style there. I think there'll be more booking of appointments. The way I described it on an interview yesterday, I don't know if you've been to France. When you go to France and you book a table at a restaurant, that's your table for the night. Right. And I think that's the way it's going to be in dentistry. You're going to book your room, and that's your room until everything's finished. And so I think some of those changes are here to stay.
Yeah, and Steve, that brings up two opportunities. I mean, your opportunity when you're doing all the pre-screening to be a positive experience for your patients.
Yeah.
You're going to lock them in forever. So that, the person who greets me with smiling, hey, Don, great, this is what we're doing and this is how we're going to do it. I mean, what an opportunity to enhance the interaction. But then when you start talking about this idea of one visit, what a potential advantage that creates for CEREC doctors and the best doctors in the world are Pacific, because it's going to be one visit dentistry. It's literally.
Story, let me tell you, you teed me up perfect. So this is a story from a doc, Dr. Bart Steers. He practices in Tucson, Arizona. And he wrote me an email. I'm going to paraphrase the first part, but basically an elderly patient that was having trouble getting his crown seated at his more traditional dentist and a traditional lab process crown. And they couldn't get it seated, and they were going to have to go get it done somewhere else or send it back to the lab. Well, the patient knew enough to look for a dentist that could do CEREC somehow. This is a 70-year-old gentleman. And here's what he said. So he went over, found Dr. Steers. Dr. Steers did the crown in about an hour. He's a quick guy, hour and a half, whatever it took. Patient sent him flowers the next day, and all was gorgeous, okay? But here's what Dr. Steers said. Without a doubt, CEREC was the biggest factor in saving my practice during the COVID crisis and COVID restrictions. Think of the number of possible exposures with a lab-made restoration. The tooth prep, the dentist taking the physical impression, the assistant pouring it up, the delivery person for the lab, the mail carrier handling the impression, multiple lab technicians handling the impression and making the restoration, the patient returning the office for the final delivery, assuming that the temporary didn't fall off, and we all know about 20% of temporaries fall off during that time. Just think of the exposures prevented by using CEREC. I mean, he couldn't have said it any more, and I'm not trying to be a commercial for Dentsply. It's just reality.
And it is, Steve. And I think, as we start thinking about what is the future when, your France analogy is exactly right. You're going to have an operatory and you are going to need, okay, I'm going to need my teeth cleaned. Most people are going to do some form of restorative, but also, as we talked about the geriatric patients, would they thrive more if you could put one or two implants in them, which is something you can do with the aids of digital dentistry. I was having a very tough conversation with my organization. We actually make the impression material. And they're like, hey, you know, we've got to change it. And I said, hey, that's going to fall into the ash heap of history, because think about it. You're going to take 15 or 20 minutes of time. You're actually bringing wet things that you're shipping back and forth to a lab. A patient, if you know, is going to do a physical impression that might have to go to an analog lab, it's 2 or 3 times. It's just not practical. And in my mind, you know, one of the biggest things that Dentsply Sirona has to do over the next 2 to 3 years, as we recognize the new normal, is, you know, we have to help every dentist in the United States practice at the highest level of their license. And by providing them with analytical backgrounds, and, you know, it's something that people like Joe can certainly help us with. You know, if we can wire up all the CEREC machines and somebody's got a quick question, well, the repository of knowledge that exists in your organization, well, we've seen that. You get you have your uncle that can kind of help you along with the process. So
right.
I think it's transformative.
And think come to mind working with your organization too, think of specialty consultations now and specialty exams using teledentistry. Now have, so a patient is in the chair and the doc, let's say it was this Dr. Steers, he made a root canal or something and wants to get a specialist to look at it. He can now do it while the patient is in the chair. Again, preserving PPE. The patient doesn't have to go to another visit. And those type of things that we can do with your organization and keep working on how innovative we can get to serve not only dentists, for you guys serving dentists, but serving patients too. They're your customer also, and how we make that experience better and better. This time is going to be analytic for companies like ours that have been able to withstand the financial pressures. It's going to be catalytic for dentistry. But again, it's the void. I heard of a lab, by the way, back to your lab deal, that the impression got into the lab and patient like a day later and said, oh, I have the coronavirus. And the lab had already, the impression had already been in the lab. The lab had to shut down.
Ooh, well, that would just be, as my daughters would say, ew.
Ew, I know.
Yeah, and Steve, you know, it's really interesting. One of the, we have a very progressive board that's been, you know, as we've gone through this crisis, they've been very helpful saying, think about what is going to be changed. And we had a speaker come in and said, here were huge changes that happened after these catalytic events like the Spanish influenza, World War II. After every one of these things, something changed. I mean, think about air travel before 9/11. Mm-hmm. And I don't even think we know what this is going to push off to, but I think you just hit the nail on the head where, you know, I think you're going to be able to have probably 2 or 3 world experts in root canals, you know, that can work almost anywhere, that could be piped in immediately for a consultation. And if you don't have them, like, I'll create them and then just, you know, license them out to you. Yeah. Because I think this whole consultative discussion is going to be huge. And it's going to have to be about force amplification where, again, we're going to want every dentist and every dental assistant hygienist to be able to practice at the highest level of their license. And we're going to have to help them do that with superior diagnostics, treatment planning in a different way, and go from there. And I do think that dentistry, you know, one, I have to say, I am profoundly optimistic that dentistry is going to return to normal, if not be even better, because, again, dentists know how to deal with infection protocol. This is not a new concept to us. And you know what? I have a funny feeling that everybody, it's just like haircuts. Everybody in the world right now, you know, I need to get my haircut. Well, I got to tell you, I can't wait to get back up to Charlotte to get to my dentist. I haven't had my teeth cleaned in 6 months.
Yeah, me too. My teeth are starting to feel, I need my teeth cleaned.
Yeah.
I agree. Hey, one other thing that needs to change while you're working on some of this in the United States is the reimbursement system. So many the current reimbursement system is built on an old school methodology of how dentists traditionally practiced, right? And so that is going to be something that has to change, and it has to change fast. As an example, most insurance companies will only reimburse you 2 quadrants of scaling and root planing per visit. which to me first blows my mind. It's like, then the bad stuff just jumps to the other side of the mouth. I don't get the concept anyway. But, you know, no longer are we going to be able to bring patients back for all these multiple visits, whether it's a root canal or a post and a crown, whether it's a bridge, which we can do using CEREC, whether it's an implant, whether it's skin and root planing and endo treatment. I mean, right?
Oh yeah. Well, just do an immediate load single tooth implant is something that can be done in a single visit. So
exactly. So
but Steve,
I couldn't be more positive about the future either. I was saying, just to jump on your comment there, I think going into this, we were beginning to get in the golden age of dentistry. You know, the tech and the 3D and all the stuff you and I have had multiple conversations about. We're just beginning, and this is going to be catalytic to speeding all that up. And we are about to enter the golden age of dentistry. It's going to be phenomenal.
Yeah, and Steve, just to jump on what you were saying, you know, I bet you an enterprising organization that has superior access to data and clinicians is going to be able to go to large insurance companies and say, I can rock your world if you cooperate with me. And I know you would have a partner right away standing in Charlotte, North Carolina, that would be happy to carry the bag in when we have those conversations, because it's true. You know, we got to change the model. You got to change.
And you've seen our data on CEREC. It's been our breakage rate and our problem rate with CEREC has been on a decline forever. But hey, one interesting thing. I know you're dedicated to mouth-body connection too. The only project in our organization we did not stop was our transition to Epic as our practice management system. I think you knew that, so we could integrate with overall healthcare, right? In the very first month, we didn't push this, no effort behind this. Very first month, there were approximately 5,000 interactions between clinicians looking at the patient records together. Whether 3,900 of them outside physician groups or physician primary care, whatever, looking at the dental health record, and 900 times the dentists were looking at the patient health record. It was like they want it. They want to be part of the patient's overall health.
And think about it, Steve, in a circumstance where you're going to have to be doing risk profiling as people come into the office, you know, they're going to hit Epic, boom, 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 boom. Okay, here are the comorbidities, here's everything else. You know, again, a data-driven organization, and again, I've seen a lot of your data, you know, I think, again, you've set yourself up extremely well. And again, it really bums me out when we get declared non-essential and not part of an overall healthcare mix, when you can demonstrate with Epic that, you know, to be honest, you're creating a safer patient experience by looking at the patient from an integrated perspective. And then ultimately, I guarantee you, people who are experiencing healthcare along the whole continuum that can now be measured with Epic, those people are going to do better. They're going to cost the system less. So again, I salute to the organization.
Yeah, thanks.
Hey, gentlemen, I'm going to interrupt you if that's okay. We've got some questions starting to come in, but that was riveting. Really good information. Appreciate that conversation. First question is this, for both of you, really. Steve, maybe you could take it first. How has the pandemic affected the investment in technology, being that it's such a big concern for CEOs across dentistry? How's it affected PDS and what they're doing from a technology investment perspective?
The answer is, that's a great question, first off, and it's the twofold answer. One, it's definitely slowed our investment. The financial hit that we all experience. I mean, essentially, when you look at the operating cash flow of almost every dental organization in the United States, if not the world, essentially all dental organizations were insolvent for a period of time. I mean, from a pure finance standpoint. Now, we're not insolvent, we're not going bankrupt. We had adequate liquidity, and we will come back, and we're already seeing that for sure. But it has taken us, all of us have taken a hit. We'll probably all have a little bit more debt on our balance sheets and things like that. Yet, it's going to speed it up dramatically in the very, very near future. We believe that we will be back to about, we call it normal, new normal, whatever you want to call it, Q1, by the end of Q1 21. Initial signs are we might beat that, and it's going to speed up our investment into technology.
Awesome. Awesome. Don, as you think about this pandemic and your R&D efforts, have you had to pivot at all in those efforts as it relates to that question?
Yeah, it's interesting. I would almost answer it the exact same way Steve did, and it's different businesses. But look, we put a ring fence around 5 or 6 things that we think are absolutely essential to what we have to be doing, over the next year and a half, and we protected them. And we did the same thing. Steve talked about debt and liquidity. I mean, we didn't need it, but we pulled down cash from a revolver just to make sure that we had adequate liquidity to make sure that we can keep doing what we need to be doing. But, if you were the number 7 project, Joe, you're not getting a lot of love right now. And that's tremendously disappointing because we're a science-driven organization. And actually, I think the biggest challenge I have is to actually make sure I can keep the engagement. The top 5 projects, I mean, and the nice thing is the top 5 projects tell the number 7 through 10 projects that they're not top 5. So, we've got a culture that we've got to kind of rev up and protect. But we've been hard at work, and we didn't stop. We didn't stop the people. We didn't stop spending on, and actually, I have a board presentation on Monday. Our R&D spending in 2Q, which was the most challenging quarter of our company's history, was the exact same as Q1. So we cut other stuff. We didn't cut the R&D.
Yeah, I wish I was as lucky. We obviously couldn't do that. So that's great. Great to hear.
Here's a question, I think probably for you, Steve, and then maybe Don, if you've got thoughts on it, is does the future of dentistry include negative pressure rooms?
So I have no idea whatsoever, and I don't think there is anybody out there yet that does know for sure yet. I think the scientists I've talked to have said we need to wait for the science to come out and figure that out. If it requires that, we'll do it. If it doesn't, we won't. I think we all need to be a bit patient, a bit more patient, and wait for the science. We've all read of the dentists that have reacted to this around the country and have set up rooms and done their stuff. That's great for them. I want to wait for the proven science to come out before we do a massive rescaling of how dentistry is conducted in the United States.
Wow, Steve, you were more conservative on that than where I would have gone. I mean, I guess we're all going to buy Teslas with the HEPA filter, and we're going to drop the patient in those. And it's interesting. I came out of the medical industry where obviously large scale operations are done in negative pressure rooms, with the double doors and everything like that. I think, obviously we've got to follow the science, but I think there ought to be a little bit of a step back in terms of when you throw a term like a negative pressure room and you start talking about air handling requirements, okay, well, to what level? And, what science is going to be done? Because theoretically an operatory with a double door to allow, a true negative pressure room is a fundamental change. And I for one don't want to see 1,000 dental offices in the United States, because that's the only places that they could afford to do a true room.
Absolutely.
Yeah.
Awesome. Another question for Steve. It says, where do you see the acquisition landscape headed within the DSO industry, especially considering potential declines in multiples?
Yeah, it's interesting. That's a great question. I think all the larger groups anticipated there would be a plethora of acquisition opportunities coming in. There will be a few. The latest as of last week, I think there'll be a few. We're getting calls from banks to come rescue some companies now, or I am getting calls. But I think what the data is showing, and I think Marco Vujicic at the ADA had some really good data, a couple others. the data is showing that it's the individual practices out there, anywhere in the neighborhood of 20 to 40% of the numbers we're seeing may never reopen. And those dentists are either going to want to sell their practices or be affiliated with a group or do something. I think that will probably play, and there'll be some consolidation, because it definitely helped for us, right? For PDS to be bigger, help support the docs and help them stay open. So we'll see how it plays out. It's going to be really interesting in the coming 12 to 18 months.
Absolutely. Looks like it's a question from a fourth-year dental student. What do you see the employment environment being like over the next 6 to 9 months?
Yeah. I can't sugarcoat. It's another really great question. I'm doing roundtables with D3, D4 students once a week right now, talking to them about it. So I can't sugarcoat this one. It's going to be really tough. You, as a D4 student coming out, I would be differentiating yourself. I'd be looking at how you're the top person, top choice to come into an organization, how you can be a creative, add value right off the bat and day one. Most companies are not going to have the time lag and capabilities for dentists to come in and not be productive fast right now. It's just, it'll be a financial imperative for them. And so one of the suggestions I had to a bunch of D4 students that I still think is a really good opportunity for them is there are many larger practices out there that have fairly good volume. Go to that practice owner and say, hey, look, got my license, I need a job. Can I just come in and take the overflow for the day? Can I take the overflow? I'll come in, pay me whatever, whatever base salary, or pay me a percentage of what I do that day, and allow me just to serve the emergency patients or patients that are on hygiene that need a filling or a crown. Let me be your overflow person that day. And my bet is you'll pay for yourself and you may just work your way into a job. That was my recommendation to a lot of the D4 students.
Awesome. So we've come to the end of our time. What I'd like the two of you to do, maybe take a minute if you've got a parting comment that you want to leave with the audience, and then following that, I'll summarize the rest of the meeting here.
Let me lead it off, Don. You can finish. What's really great to see is the partnership happening between some of the large groups and the large manufacturers and the large distributors. In the last month or two, those groups have come together in a way to help each other out. They represent the vast majority of the leaders in dentistry, and it's been great to see the teamwork. I mean, Don and I have had more calls in the last 2 months than we did 2 years. So it's great. It's just a great partnership. The better we work together, the better we will all do.
And thanks, Steve, and thanks, Joe. I really appreciate the opportunity to and Steve, I always enjoy being on stage or other places with you. The passion you bring for dentistry and the overall vision for oral health is one that we're inspired by. So really appreciate this. And look, I would just finish by saying I'm profoundly optimistic about dentistry. We're too important not to be essential. And I'd like to think that people like Pacific and Dentsply Sirona, when we work together, can not only serve the better good of the patients, but we can actually help move overall health forward in the United States with a different model. So again, just thank you so much. And I hope everybody stays both safe and healthy. And remember, every single morning the sun rises. It's remarkable. Every morning it keeps So, you know.
That's awesome. Well, we want to say thanks to both of you guys. There are a lot of questions, just so you know, that we weren't able to get to. And so there's more opportunity in the future for opportunities like this. That being the case, thanks to those of you who participated in the listening audience. We expect that there will be more webinars such as this. So keep an eye open for press releases on opportunities like this. And with that, I'll say thank you again.
Thanks,
And
Joe.
bye.